Leader Smith, one of the biggest issues this session, and of course it's a big issue nationally, is whether or not to expand the Medicaid program in order to try to expand the safety net to comply with President Obama's new federal health care law. And to do that in Florida would offer that care to an additional 900,000 to 1 million people. Governor Scott said yes to that, at least for 3 years, when it would be funded 100%, but both the House and the Senate now have said, nope, not so fast, we want to do our own thing, right? Where do you stand, and where do the Democrats stand on that?
Well, we stood with the governor, surprisingly, on expansion. But I was proud the Senate, we didn't say no. We're saying a hybrid. Senator Negron, the appropriations chair, has floated some ideas, and we're discussing it now in the Senate, which would basically expand kid care. It would make
Florida's program.
Yeah, Florida's kid care program, and just open it up to parents now and others to go after that 900,000. Because as you know, according to what stats you look at, we're maybe second or third in the nation in uninsured. So using the kid care system that we already have to go ahead and get those people into a healthcare system. Now, we're still figuring out whether we need a waiver, how the feds are going to look at that, because the way that the law is set up now, the feds will take care of most of it for the first 3 years. We'll take care of all of it for the first 3 years and then drop down to 90%, and we're still having to pick up 10%. So we got to, we're paying the money already, and we're going to be paying the money. I think where the governor went on this was, we're paying the money already. Now, we can either draw that money back down and use it to insure Floridians.
Meaning we're paying into the federal
healthcare system.
Okay.
And it's one of those, we can either come up with expand Medicaid or come up with a system that gets healthcare out to that almost 1 million people, or see our dollars that we're paying up to Washington already go elsewhere. And I think the governor made the prudent decision, and I think the Senate is headed towards the prudent decision. We're just trying to pull the House along with us to make sure that we come out of this session with something.
Well, one of the questions I have is, will the federal government approve this? It's kind of radical in a sense. Here's a state saying, we kind of want to do our own thing. We want your money, but we kind of want to do our own thing. We don't want to set up these exchanges necessarily, and we still want our money, and we want to do it our way with managed care, private insurance, et cetera.
Well, it's still the same concept. And whatever it takes for them to get over the hump of expanding health care, we're going along with. But it's still pretty much Medicaid expansion. It's just not the Obamacare. It's, Florida legislative care somehow. I think the federal government now realizes, with the resistance of states, the federal government's starting to bend a little bit and say, okay, we'll look at your plan. If it gets the objective, we'll go ahead and give the waiver.
Okay. So that's interesting to me, that there is some support for that program coming out of the Senate.
Well, there's support for Medicaid expansion from the Democrats, but if we don't have Medicaid expansion, we're cautiously supporting whatever we come up with that will use the federal dollars to get health care out there.
Thank you for that clarification. The governor also kind of surprised a lot of people, including Republicans, when he said that he would support an across-the-board $2,500 pay increase for teachers. And I think that amounted to about $450 million. And in the past, Republicans haven't supported across-the-board pay increases. They've supported merit pay increases, and I think that's really where they're coming from now, kind of crossing the governor's recommendations. Where are you and Democrats on this?
Well, a couple of things on that. First, I think what the governor was saying, he goes back and forth, is pay increase or bonus. And those two are very different, because the bonus would only be this year. But even at the $2,500 pay increase, we're totally in support, because if you remember, Steve, 2 years ago, the legislature began to tax its employees and teachers, having them put 3% into the retirement plan. So you've had state employees and teachers who haven't received a raise in about 6 years now are 3%, more in the hole. And so anything we can do to get them back to where they were, at least, we support. And when it comes to merit pay, and if you want to do the merit pay type system, good. Give everyone the raise. Give everyone the $2,500 raise, and then use bonuses for merit. But we need to take care of our state workers and our teachers. It's been 6 years. State workers and teachers are some of the lowest paid people, in society. And when it came to the retirement plan, the argument we made is they made the choice. They say, I'll take a lower pay, but I got a good retirement plan from the state. And then we kind of changed that around and made them contribute to the retirement plan. So anything we can do to get them at least near back whole as to where they were before Governor Scott and the legislature started taking away, their dollars, we support.
How do you feel about the defined benefit versus defined contribution argument about going forward with reforming the retirement plan?
Well, we have to make sure that the dollars work out. One, our retirement plan is very healthy. We have one of the healthiest retirement plans in the nation. And so, if you look at all the rating systems, we're very healthy right now. And going forward, now, if you start pushing people into another type of system, a 401k type system, what does that do to people that are in the system now? Because you need new people in to keep funding it. It's like Social Security. You need the new people in to keep funding it. How is that going to affect people's benefits now is the concern. And then I think one of the biggest default fights is the default system. Are you going to default people into the 401k type system, or are you going to default them into the system that we have now? And so if the dollars work out, giving people a choice, we have no problems with that. But it needs to work out and make sure that those that are in the system, those that have been working for the state for many years and who counted on this retirement, making sure that we do not affect that in any way.
2 years ago, before the 2012 election, there were all kinds of changes made to the voting process. Number of days, number of polling places, all kinds of things. And now, after long lines that were seen on television and so forth, coming out of Southeast Florida, your neck of the woods, and others, there's a big voting reform package or elections reform package going through the legislature, addressing some of these issues. How do you feel about this package of voting reforms? Is it going far enough? Is it doing the right thing? Is it opening up the process wide enough for people to feel like they can have a chance to vote?
Well, it's clearly not going far enough. And I started this year saying, I told you so, when they passed the bill 2 years ago and made all these radical changes. And we saw it coming. We saw what was going to happen. And we warned the legislature that don't do this. We're going to be the laughing stock of the nation again. And it happened. So now we got to go back and try to fix what we messed up on 2 years ago. And still the legislature is hesitant on going forward. The Republicans in the House and in the Senate, they aren't doing what's necessary. They're not making things mandatory.
Like what?
The number of days, voting on the Sunday before the last Sunday before the election.
Meaning that each election supervisor can make that decision rather than making it statewide. Is that what you're saying?
Yes. Under the bill that the Senate passed, that the Republicans in the Senate passed, it would not change one thing in Dade County. Everything that Dade County did last time, all those long lines and those problems, changed none of it. Dade County could do the exact same thing because everything is permissive. So what we want to do is ensure not just Dade County and Broward County, but Hendry County, Polk County, Dixie County, make sure that everyone has the ability to vote and mandate days, mandate times that we should do. Some of the proposals we've put out there that haven't been included thus far in it is giving people an ability to cure the absentee ballot. If Steve sends in an absentee ballot and the supervisor sees, oh my God, it doesn't have the right signature or is missing a witness, and it's 48 hours, out from the election, they contact you and say, hey, Steve, we're going to give you an opportunity to come in and fix this ballot. Things like that, giving everybody an opportunity to vote. So we still got a long way to go to at least get back to where we were 2 years ago before the Republicans changed everything. But I don't want to just settle for get back to where we were, but let's make it better because we learn every time. Let's learn from everything and even go further just to make sure that no matter what, however people vote, they have an opportunity to vote.
Last question, we got a couple of minutes. As a leader You've helped to set the tone, set the goals for your party, and so forth. Halfway through the session, roughly, what do you see going forward that you would say, these are two things I really want to see us do this session? Could you elaborate on that? What comes to mind right there?
Well, the two things we just discussed, healthcare and elections. Making sure at the end of the session, when they drop those handkerchiefs, that we can actually look out and say, you know what, 1 million people in Florida, 1 million people are now going to have access to healthcare. 1 million people who don't have access right now are now going to have access. And when we look out and say, you know what, we fixed voting. We've made it so that we're not going to be the laughing stock of the nation, that we have the most liberal voting, not liberal as a thought process, but the voting process there is, that everyone has an opportunity to vote and can go in and let their votes be counted. If we finish with those two things, I consider this session successful. And I think we're headed that way.
Well, when you sit down and say that sort of thing to President Gates, does he you feel like he might want to help you?
Yeah, he agrees. And the one thing I can say about Don Gates and all of my Republican counterparts, we want the best for Florida. Every 40 members of the Senate, all 120 members of the House want Florida to be the best state in the nation. It's just how we get there is where we differ. And as long as we can remember that, as long as I know that every member in that building want Florida to be the best in education, want us to have the best health care, wants us to be able to have the best electoral process, want us to have the best. As long as we keep that in mind, we just differ on how we get there, I think it goes a little smoother. When we don't villainize each other and know that we want the best, let's work towards getting there.